Welcome back. I am Sister Tandy. If you have just been told that your medical is subject to further review, I know what you might be thinking. Is something seriously wrong? Am I going to lose my job? Please take a breath. A review is not a crisis. It is our way of being thorough. Let me explain exactly what it means, what happens next, and what you need to do. For employers, understanding the review process helps you support your workers through it. Always consult with your healthcare provider. A review happens when one of your test results falls in a borderline zone that needs further interpretation by our occupational medical practitioner. Maybe your blood pressure was slightly elevated and needs a second reading to confirm. Maybe your spirometry showed a marginal decline that needs to be compared with your baseline. Maybe a finding on your chest X-ray needs specialist assessment. In all of these cases, the review exists because we refuse to make a snap judgment about your fitness. We want to be sure, and being sure takes a little more time. A review does not mean something is seriously wrong. It means we care enough to check twice. During the review period, what happens to your work depends on the nature of the finding. In most cases, you can continue working while the review is processed. If there is a safety concern, you may be temporarily assigned to alternative duties until the review is complete. Your employer receives a temporary certificate that indicates the review is pending. This is normal. It is not a black mark. It is a process. For employers, a pending review does not mean the worker is unfit. It means the assessment needs more information. Support the worker through the process. What should you do during a review? First, follow any instructions you were given. If you were asked to see your doctor, get glasses, or have a follow-up test, do it promptly. The faster you complete your part, the faster the review is resolved. Second, keep your documentation. Bring any referral results, specialist reports, or follow-up test results back to CareNet consultants. Third, ask questions if you are unsure. Our team can explain exactly what is needed and why. For employers, check in with your worker during the review period. A simple conversation shows care. The review timeframe varies depending on what is needed. A simple blood pressure recheck might be resolved in days. A specialist referral might take weeks. Pathology results from a blood test are usually back within a week. An occupational medical practitioner's review of an X-ray may take a few days. Throughout this time, communication is key. CareNet consultants will keep your employer updated on the status, and we are available to answer your questions at any time. Always consult with your healthcare provider. The emotional side of being referred for review can be significant. Uncertainty is one of the hardest emotional states. You might feel anxious, frustrated, or afraid. These feelings are normal. Remember that a review is a sign of thorough care, not a problem. If waiting is affecting your mental health, SADAG is available at 0800 567 567 or www.sadag.organization. Talk to someone you trust. The uncertainty will pass. Always consult with your healthcare provider. For employers, when a worker is referred for review, communicate clearly. Explain that it is a standard process. Reassure them about their employment status. Help them access any follow-up care they need. And please, never use a pending review as grounds for disciplinary action. It is a medical process, not an HR one. Always consult with your healthcare provider and safety officer. Your employer arranged a medical that is thorough enough to include reviews when needed. That thoroughness is protection. A quick, superficial medical that misses a borderline finding is not doing you any favors. The review process exists because your employer chose quality over speed. Always consult with your healthcare provider. Now you understand if you were referred for a review. what it means, why it matters, and what to do about it. In our next video, we explore why medical outcomes differ. Always consult with your healthcare provider. Keep watching. If you are referred for a review, write down your questions before your follow-up appointment. What was found? What does it mean? What are my options? What happens next? Having your questions ready makes the appointment more productive and less stressful. Always consult with your healthcare provider. Your best is good enough for today. See you next time. CareNet Consultants, your partner in workplace health.